to avoid overpopulation in hospitals. So people who are not like almost dying, they could go to these clinics and be attended. So hospitals would be more for emergency cases. And they claim that they have all kinds of equipment and so on and so on. Okay. That we call SAMU. It's a mobile emergency care service. You can call whatever. It doesn't matter where you are. And the purpose of this is like if you are severe injured, you can be treated in the way of the hospital. So you would be attended in the vehicle. Okay? And there are as well popular drugstores that they sell low-cost medications. And if you prove that you don't have any money, you can get it for free. Medication for free. Okay, so let's see the high levels of university care in Brazil.
This unassuming medical clinic is on the front lines of healthcare delivery in Brazil. Located in Vila Canoas, a slum in Rio de Janeiro, it serves some 600 families from the surrounding community. A member of the health team, some of whom live in the slum as a condition of working here, shows us around.
Our vaccine campaign is done in this room.
We move by the messages posted on the wall, warnings about the dangers of smoking and dengue fever. The focus here is not just sickness, but lifestyle and prevention.
Here's the doctor's room, and she's currently seeing a patient.
The young woman being treated today is Joana Loureiro de Almeida Ricardo. She's 17.
I decided to come because I had a strange pain and I got worried. They gave me the medication I needed and I was treated very well.
And just as important, did she have to pay for this visit?
No, I didn't have to pay.
Healthcare in Brazil is a right. That's the law, and the state must pay for it. And so in this country of nearly 200 million people, there are no uninsured. And the array of free medical services extends from vaccinations to organ transplants to, more recently, sex change operations.
Since Brazil made this vast array of services a constitutional right 20 years ago, many indicators of the nation's health have improved, such as infant mortality and life expectancy. And while some wealthier Brazilians opt out for private care, today 3/4 of the population relies on the public system.
I think any society has to provide basic health care for its members, and especially those who are the most vulnerable.
Dr. Daniel Becker is an expert in healthcare policy and helped create the national program that provides free primary health care here. He says Brazil's focus has been to deliver health care to those who need it most, the poor, who make up some 60% of Brazil's population.
And I think this has been done to a certain extent, not with the quality that we should have done it, but we could have done it, but in many ways in a pretty revolutionary and innovative way.
He's talking about the 25,000 community healthcare teams all across Brazil, like the one in Vila Canoas. Physicians are paid up to 3 times more to work in the poorest, often most dangerous areas. It is personal and proactive. They reach out even before the patients come in.
We try to always get into their homes.
Barbara Gomez, 24, is what's called a community health agent. She lives in Vila Canoas, and her job is to knock on as many doors as she can.
Our work is to register all the residents, and that way we can follow them. Those who have hypertension, diabetes, those who are pregnant. We work in health promotion. It's not just about addressing the problems.
On the second floor, the clinic is sponsoring an art project for the developmentally disabled.
And what are you making today?
Today we're doing mosaics.
She tells us this work for her mind is good medicine too. And you don't have to go to a clinic like this to find free health care. In downtown Rio, we stumbled on a storefront setup offering free vaccinations against measles, mumps, and rubella. A woman in line was shocked to hear from me that shots in the States aren't always free. We discovered another vaccine booth, of all places, at a rodeo outside Sao Paulo. But offering so much to so many has put a strain on the system.
Everything is given, everything is the right of everyone, and everything is free. So it is impossible, basically, doing that.
With the current focus on primary care, it often battles for resources with Brazil's hospitals. And the result? The hospitals often come up short. A recent study by the World Bank called most of Brazil's hospitals substandard and said that many deliver inefficient, poor quality care.
The hospitals are a very serious problem.
Are there long waits for complex procedures?
Absolutely, yeah. Very long waits and sometimes very bad quality.
I mean, isn't this an inevitable consequence when you try to be all things to all people?
No, because we have to have social responsibility regarding health. And ideally, you have to provide optimal health care to everyone. Of course, at some point, the system will find its limitations because you cannot do everything for everyone at any time.
Becker says Brazilians still prefer their system, with all its flaws, to that of the U.S., where so many people have no guaranteed access to care at all.
I think this is really sad. In a society which is so rich, to leave people out of the system because they're poor, it's pathetic.
That's the issue millions of Americans are pondering as the new administration prepares to overhaul our healthcare system. Brazil is a good case study of the highs and lows of universal health care. I'm Edie Magnus, reporting for World Focus in Rio de Janeiro, Brazil.
Okay, good. So, my point of view of the problems in the system. The government, in order to be equivalent to like richer countries, the government should spend 10% more, should invest 10% more in healthcare. So, corruption is something really bad in Brazil. We do have a lot of money. Brazil has lots of money, Brazil have money of as much money as any other rich country, but there's corruption. Some politicians take advantage of it, and this ended up like our money ended up being not really well distributed. And of course, the main problem is their lack of doctors to work in the poorest areas for many reasons. Nobody wants to work in a place which is dangerous, and they're not really well paid. So why would you sacrifice your life to not worth so much money? So my aunt is a doctor in Brazil. When she graduated, she went to work in one of these clinics in a very poor area in my city, and she said it's very sad as a doctor and as a human, because you can see like doctors in Brazil, they are more worried about money, I think, and for example, they earn this salary, but they don't want to work this amount of time. So what they do, they limit their patients a day. So for example, I am a doctor and I work in a poor area, so today I'm gonna attend only 10 patients. So if in a clinic where there are like three doctors, only 30 people would be attended, because they don't want to work more because they don't earn as much as the other doctors. It's really sad. It's like people are not to be blamed because you don't earn as much money. So for example, if I'm really sick and I am the 11th person in this clinic, I'll have to stay overnight to be attended. Even though it's like a flu or something really simple, they would not attend. That's what happens. It's really sad.
The Brazilian healthcare system is in theory one of the best in the world. But as Juani Carvalho reports, the biggest problem with it is it's not delivering on its promises. Long lines, lack of enough doctors, medicine, and other facilities is making the delivery of free services very difficult, if not impossible.
It is common in Brazil to see children die in the halls of the public hospitals, sometimes for lack of assistance, another time because they don't have enough medicine. The need for infrastructure facilities and the vast numbers of patients at health clinics and hospitals are issues that the average poor Brazilian has to deal every day of his life, because they are too poor to pay a private facility. They are the individuals who do not have the ability of obtaining better insurance coverage, the people that must confront long services lines and has to wait months and sometimes years to get a non-emergency surgical procedure.
As proposed, the Brazilian system is great, but the quality is far below what it should be. In most places, there are no structures, which eventually hinder the work of professionals. Lack medicines and specialists in various areas is also a big problem.
Even though the unique system of health, known as SUS, was created with the promise to provide an excellent universal health coverage to all Brazilians, every day hundreds of Brazilians die for lack of medical assistance, doctors who are not very well paid and don't have the elemental facilities needed to do their jobs right. For that reason, it is common to see the halls of medical facilities full of patients waiting long hours for services because there are not enough beds, not enough equipment, the equipment are not working, and sometimes because the doctor is not available.
Gestão de recursos.
What we need is more money, because according to budgetary laws, the federal government should invest annually 10% of the national budget for healthcare, but it does not. Therefore, it is very difficult to implement all the care programs without the proper budget. The management needs to be improved to meet the needs of our population. The model is excellent and Brazil does not lack doctors, like the government says. We lack infrastructure.
The SUS manages about 4,000 million procedures per year, from vaccines to heart transplants, and to resolve these problems, specialists in the area are all in accord that the salvation of the public health system is bringing more money in order to improve the practice. According to specialists, Brazil needs to double the money they spend in health care, which is not easy because most of the current budget is already allocated to other expenses, or because corruption is up a great part of the same budget.
Modelo de sistema.
The proposal to provide universal access to the system is perfect and makes this program unique in the world. But the execution is very difficult because in part involves the correct and responsible use of resources. But unfortunately, we all know that much of the money is diverted, the corruption is alarming, the political use of the healthcare issue is another problem.
For that reason, about 25% of the population is forced into buying private insurance to compensate the deficiencies of the public system, even though Brazilians pay one of the highest individual tax rates on the planet. In theory, paying all of those taxes supposedly guarantees excellent services. However, the truth is that it is very far from reality. As an example, in the 7 largest cities, 200,000 people would have to wait up to 5 years for a non-emergency but necessary surgery.
We have improved the control of diseases and we have increased the life expectancy. But there are many challenges that involve resources that are too small for the size of the proposal. Too many people to be attended, but not enough money invested. Brazil is one of the few countries in the world that adopted this system, but it is also the one that least invests on the health system.
Every year, about 17,000 doctors enter the market in Brazil from a total of 197 schools of medicine. It is a much higher number than those who enter the profession in the United States and in China, and right behind India, who has 272 schools. A study by the National Council of Medicine shows that the bad distribution of doctors in the country continues. And the problem is not the lack of doctors, but how they are distributed among the population.
To solve the problem, the government just launched the More Doctors program with the objective to increase the number of doctors working in the public sector in those areas that there are not enough doctors approved the hiring of foreign doctors and Brazilians that graduated from foreign schools without the need of revalidating their diplomas, which resulted in complaints by the health workers in all the Brazilian major cities. Reporting from São Paulo, Brazil, Ronnie Curvelo, Reporters File.
So one thing that is really important to highlight is that there are enough doctors in Brazil, but not enough to work for the public hospitals. That's the saddest thing.
Just a quick question about
The world may never again see the like of China's ghosts.
Okay, what is it?
they said that the personal income tax was one of the highest in the world. Do you know what it is?
I can't tell you like percentage because since I don't work like for a certain amount of time, so I don't pay my taxes. My father pays my taxes enough for me. I can't tell how much is it, but it is a lot. It is a lot. There was a study that each Brazilian needs to work half of the year just to pay taxes.
So it's close to 45%.
I have a quick question. The people that have the private insurance, do they get preference?
Oh.
In other words, do they go to different hospitals and or doctors?
There are private and public hospitals. They're different. In a public hospital, there might be like a certain numbers of rooms reserved for private insurance and public insurance.
So do they theoretically then get a better
Oh, yeah.
care? They get better care than?
Oh yeah.
Okay.
And of course, there are, I don't know how I should call that, like a mixed thing. So for example, my mother, she works for the state. So the state, it's mandatory to pay a little bit more to have, so you could have a better health care than the public one. But that's insane. Like if you work for the state, you should be able to have like access to a quality of the private healthcare. But since it's not qualified, they offered like a cheaper private health insurance that's better than the public one. So for example, I had to be submitted to some surgeries in my life, and my mother didn't have to pay anything for it. Because and of course, something that is really important to say is it depends on the case. It depends on the region. It depends. For example, if it is urgency,
yeah,
you're gonna wait a little bit more. But if it's not, you can be attended. For example, my grandmother, she doesn't have any private insurance, and she had her eyes operated. She doesn't wear glasses anymore, and it was for free. And she has to wait like just a month because it was not a real urgent case. So there were doctors to do that. So.
And excuse me, one last question. Are people means tested? In other words, depending on your income or wealth or status that
It's
way?
a crime if you do that.
Okay.
I believe there are people who do that because people are crazy. Like some doctors, they might, treat you badly because you're poor, but they should not do that. Like it's a crime. I don't know if you heard of the manifestations that occurred in June in Brazil. Have you heard of it? There were thousands of people going to the street to manifest many different things, and one of the problems was healthcare in Brazil. So I'm gonna show just some, not the whole video, but just to have an idea that people were furious because it's like we pay a lot of taxes for what? Not to have a decent healthcare insurance. So people would go to the street to manifest their So our president got scared. So okay, what are they going to do? Because they were about to destroy the country. I was one of them. I was on the street, but I was just with my sign, wanted better health. But there were people taking advantage of it, of the crowd, and destroying historic buildings and doing all kind of mess. So what is the short solution for that? Short time solution for that? Is the project more doctors for Brazil, more health for you? It is a project that the government should pay doctors more to work in the poorest areas. However, the priority would be to have a Brazilian doctor working there. Since there are people who are not interested at all, this project would hire people from Cuba who had like 60% doctors for every 1,000 people to work in Brazil, and they would earn like 1,000 reais. That would be like $5,000-6,000 to work in these areas. Your salary would be like 1,000 reais plus board and like everything included. So it's like, and there is a big struggle because doctors are furious because, you know, if you graduated in Brazil, how come the government is hiring people from other countries? They should, but it's like an endless struggle, I think. So, but I think it's a nice solution because people in Cuba, they live in bad conditions, so it's a great opportunity for them. If Brazilians don't want to work, there might be people who want to work. Okay, it's just a fact that Brazil has 1.8 doctors for every 1,000 people, and the US 2.5 doctors. So to sum up, Brazil's healthcare is far from being perfect, but throughout the years it has shown some significant changes. SUS, our system, has faced many social and political problems. However, it is undeniable that despite this, SUS has contributed to the strengthening of national citizenship, since the right to healthcare is an important social right. I hope someday people would have like better treatment. I can see the difference now from some years ago. It has been improved, not as much as it should be because we do pay a lot of taxes, but I believe that in the near future, people would have the quality of work that the law promises. So, you know, don't believe that Brazil, okay, healthcare in Brazil sucks. It's not like that. You know, it is bad, but it's not that bad. Like, many people died waiting for treatment, but many people are saved as well. So and as it was said before in the video, it's important to have a system like that because 60% of the population of Brazil is poor. So can you imagine if we didn't have any system at all? So many people would die and maybe nobody would live in Brazil right now. So it's really sad. So I would like to show just a video, just an advertising of the country because the next World Cup would be in Brazil and the next Olympic Games will be in Brazil. So I would like to invite you to go to my country. Don't worry, you won't. Like, if you need any doctor treatment, don't worry, you have the system, which is perfect, okay? So, that's it.
Brazil is calling you. A land for all people. Resplendent, colorful beauty. Where races and cultures converge and find strength in their diversity. A joyous people with pride in their country. A generous land that captures and fascinates visitors. Brazil draws attention with its exuberance and demonstrates to the world that it's much more. Modern, democratic, creative country. A prosperous, stable economy and full growth, drawing more and more business. investment in infrastructure, airports, transport, and personnel training creates a favorable environment for Brazilians to practice one of their best talents, hospitality. The selection of Brazil to host the two largest sporting events in the world fuels a flame that already burns bright. The people's passion for sports. But you will only discover the best part when you arrive. The Brazilian people. Land of every color, rhythm, and flavor. Land of diversity. Brazil is calling you. Celebrate life here.
So I hope you enjoyed. Like I'm here during this year to promote Brazil's culture. So thank you so much for listening to me, and I hope that you leave this room knowing a little bit more about my country.
So hopefully they have some questions.
Okay.
Anybody have any questions? Go ahead in the back.
I had a question about when you travel to Brazil and you get sick in Brazil. You said that SUS you would go to the hospital. How does that work? I mean, do they need to see any identification?
They don't ask for ID. Like if you're sick, like they might ask you your passport. You need to be legal, of course.
Right.
But they if you are foreigner, you it's for free. Like you just go there, say your name, and you say your name just to be called. It's really simple. You don't need to have any social security number or any.
Most other countries that have universal health care are the same. Canada, you go to the UK, you're a tourist or whatever, you're sick, you get treated. They don't send you a bill.
Let's suppose that that I am very interested in going to Brazil to teach English, just to go to school and just to learn a little bit about Brazilian culture.
Okay.
What should I do? Where should I go? What would be the first steps for me to take?
First, decide where you're gonna go. Like if you're gonna go to Rio or if you're gonna go to the south, and then look for English schools that
Online,
yeah.
Uh-huh.
And then you can send your resume, or like I would send my resume and tell, okay, I am an American, so I have a degree in this, even though it's studying education, and I would be interested in teaching English because blah 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 blah.
So Mariana, you suggest the private English schools?
Because if you work, you cannot work for a school because you need to have a certificate. But these private schools, they can hire any person who knows English and has some.
Question. The Festival of Carnival, how long does it last? And is it based on religion? Is it before the Lent season for Catholicism?
The origins is kind of unknown. It is believed that it is Christian. It is before Christian, like when in Greece there was God celebrating life and so on, and in some way Christianism adapted this concept and it was brought to Brazil. And it's the holiday is on a Tuesday, but since it's February in Brazil, it's summer, so most people who celebrate.
It's the Tuesday before Ash Wednesday, correct?
Yeah.
So it's similar because in the United States we have Mardi Gras in New Orleans, which I think is a similar type festival, but this I think it's the real deal. So I'm just trying to see if they're correlated there.
No, the holiday is on a Tuesday, and since most students are on vacation, they have like, they celebrate Carnival during